He told me about TV several times.
Even available in
Yes, yes, yes.
Recently, our President appointed each district a coordinator. In Jaffna district, our Major General Senarat Bandara is a security for a good opportunity. With the help of him, we can easily handle this COVID-19 situation. Each and every sector we are facing different ways for this situation. However, that one coordination as the national level through our COVID-19 center. That center is in charge. Our General Savendra Silva, Commander of Islam. Under this setup, each provincial has that provincial coordinating committee and our honorable governors. Then our district level and divisional level and gram level also we are handling this matter. So that this is our national coordination through the Major General. In future we will together, each and every sector, we will together take necessary action in order to face this COVID-19 pandemic situation. With this, in this remark, I warmly welcome our Major General Senarat Bandara, Senior DIG, all brigade commanders, all divisional commanders, all brigade commanders, base commander Air Force, Comnorth representative, and provincial director of our secretary to the education Northern Province, provincial director Dr. Kediswaran, additional GS, and our divisional secretaries, and other distinguished staff officers and invitees. Once again, I warmly welcome all of you and good morning to you all. I think based on this time concern, we will immediately go for the presentation, and also I warmly welcome our Major General to deliver some.
Senior DIG, all division commanders, Provision Director Health Kediswaran and secretaries and divisional secretaries, senior Air Force officers, DIG, and ladies and gentlemen, compliment for the season and 2021 started with in a good way, with very positive way. So government has appointed me as a COVID coordinator in Jaffna district. So I had a meeting a couple of days back with the GA and some senior officials, and I have made a small presentation. I think the Dr. Kediswaran, the provincial director health, is the key person in this operation. We have made a very small presentation to educate you, and existing program is very good, and certain areas we have to tie up. Messages should go to the grassroots level. There should be a proper propaganda vision system to educate grassroots level, and as compared to the other districts, of course, Jaffna district is okay. I think with the police, with the Army, with the Navy and Air Force, and also the health officials are working together. Already we have appointed a monitoring group inside the GA's office, and they are coordinating very well. But I think this mechanism should a little bit we have to enhance. I think Dr. Katie, you can advise us how to handle this, and with this small introduction, I think we'll straight away, as per the time concern, we'll go to the presentation. If there anything, let us know. We'll clarify everything. The main request is, especially the division secretaries are very important. You will have to conduct a meeting with your Grama Niladhari, especially when people come from other districts, other areas, and settle down in the village side. You should know. The police is having a good mechanism. Other day we discussed about this matter. Senior DIG also here today, and DIG gave a statement. The SSP also gave a statement that when a person comes to the village, there is a mechanism. Through Grama Niladhari, it is being informed to the police, and we are going to home quarantine, and we are very much concerned about the outsiders comes to the district. With that, we'll go to the presentation. Certain things that I am expecting from, actually this is teamwork. This is what we need, how to protect this district, how to prevent getting infected of the COVID-19 from the villages as compared to the other. First of all, GA District Secretary, already we have discussed this matter. Come on. Just present status of COVID-19 preventive operations in Jaffna district. We have established one quarantine center at Vidattapale. There are 209 personnel who came from Kata. They are undergoing on quarantine, and mainly we have two ICCs, Mardankani and the Kopai. That of course, Kopai is of course strength, and we have to find out a better place, at least another 2 to 3 places in Jaffna district. If there any situation, if there any emergency, we should be able to organize a treatment place for the infected people. We should not allow Jaffna district people to send out from this district. So Dr. you can advise me on this issue. We will give maximum support to prevent. Okay, next. The existing plans, allocation funds for intermediate care centers, ICCs, home quarantine and mechanism distribute of funds. Of course, other day we discussed about this matter. Home quarantine people are getting a dry ration pack. Already G has organized this through divisional secretaries. It is functioning. It is moving properly. So quarantine people should not move around to find their daily needs. The second thing is contribution of government agencies prevention of COVID-19. This is already we have the existing program is okay. Dr. Krishnan, you can tell me if there anything you want to add. We need to find out another place. Actually, we have found a place in Vadukade, that is training institute. If we can convince this matter to the bishop in that church, there are 14 members in his board of governor. He is the board of governor. So we will take over this place, and we will organize technical college Vadukade. will make necessary arrangement. Divisional secretaries will agree with me, in the GA will agree with me. We should not allow, if there are any infected people in this peninsula, we should not allow these people to go to some other place. We should organize that a place in Jaffna district itself. Next. Awareness program is another important thing. I know that media is doing a wonderful job. If you talk to people frequently, I know that divisional secretaries are meeting your Grama Niladaris every week. For every meeting, we should give a very little speech about this COVID-19 situation. So that in the meantime, Grama Niladari can go to his village or his area, and he can deliver a small message to the villagers. For example, 3-4 days back, 3% from Gurunagar went to South India and they were arrested from South India. You know that at present the latest virus is already there in the South India. So through them, through the fishermen, through some illegal activities are taking place, some people are moving around there. So we should not allow this to happen, and they might bring this latest virus to the land. So we are very much concerned. So that is what we need to have this awareness program, especially the fishing community, especially the people, the businessmen, tradesmen, those who are going out from the district. And as you are aware that Mana district, some Pesal area also, there are some 5 to 6 people got infected 2 days, 3 days back. And our workers are going, our government officials are moving to Mana, so that we will have to think about this, and we will have to educate all officials and plus villagers. The next one is joint mechanism with the health sector, police, Gram Niladari maintain database. Already our monitoring committee established in the GS office, we are monitoring this. Present situation, pandemic and conducting PCR test, rapid antigen test, of course, Dr. you can explain it, what's the mechanism, and if there anything to be arranged, of course, through GA, we will inform the COVID, the headquarters in Colombo, and we'll arrange whatever things we need. Analysis of on future spreading COVID-19 pandemic, possible preventive measures. Of course, you can advise on this issue. Monitoring process of home quarantine personnel, very important. Even though we put on a home quarantine, the people are moving here and there in the village side, and there is no control. And so we should have a proper mechanism. At the moment, the military personnel cannot deploy the very close proximity of those quarantine personnel. We cannot do this. Only thing is we can block all the existing routes, entry-exit routes, and we can make the announcement. Selection suitable premises of function intermediate care center for the future requirements. Already we have discussed. Availability of funds, immediate functions to newly earmarked ICC. Actually, beddings and other infrastructure development we will arrange. The other things, minor repairs and everything. I met the health secretary the other day. I informed him already about this issue. And if we find a place like technical college, there are some areas to be improved. We need funds for this. And if you utilize funds, of course, with the help of Army work unit, we can complete. This is for your information. cost per person for quarantine. Right, okay. The procedure for non-COVID deaths within the isolated area, very important. So should not allow people to gather, and those things, of course, arranging a time trial. The police also informing, PHI also informed. We have to practice this, and we have to educate people. Waste management is so important thing. Kupai, of course, we are managing. If you start at another place, the waste management. Then the preventive measures for spreading new COVID-19 virus originated in the UK from migrant, from Indian and fishermen already we have discussed. That of course Navy is doing well, and they are trying their level best to coordinate this and prevent any fishermen crossing. And if there any system, anybody, any migrant arrested by the Navy, there should be a proper place for them to quarantine until the court case is over, until the court proceeding is over. There should be a place. Last time 22 personnel came to the shore, and we couldn't find out a place for them to quarantine. So there should be a place. I think my proposal is that the Navy should have a separate place with the help of Fisheries Ministry, and I think Dr. Krishnan, we have to concern about this. And when they take it to the courts, of course, we have to take maximum precautions. We have to quarantine, and we have to do the PCR test, and once it is confirmed only, we can go to courts. Until such time, we cannot allow these people to be inside the booth. It is not the good system. So in fact, I spoke to your from North about this police energy. Details of available resources, shortfall, ambulances and PP kits. If there anything, Doctor will let us know. We'll discuss this. Right? Okay. Of course, senior DIG and the army, we are coordinated already these things. Of course, public awareness program, identification of locomotion individuals from other districts. So important. Sagopinti and Elephant Pass, we have established a roadblock. In that, you cannot stop everybody. You cannot check all the vehicles. A lot of vehicles running here, and at least we should organize test system. Then so people will get a message. If you can arrange it, yes, this is very important. The only way to comes to the Jaffna district. Then already we discussed to enforce the COVID-19 law and regulation within the district. As you are aware that already government instructed that the media spokesman, police media spokesman convey this message to educate this message to everyone, adhere to all these health guidelines. If anyone violating this, there is a provision for police to arrest or to take legal actions. Next. From North, of course, already I have been unable to come for today's meeting due to certain important matter. Marshalling points should be spent, and
yes, sir. At the moment, we don't practically check them. We monitor their movements.
okay, I mean, if you have surveillance systems, already we have a special unit for this. Responsible officials are here to deliver a message to the grassroots level, and At the moment, we are doing well. And further, if there are any assistance, any instructions, Dr. Kesan, for you to tell about this. Please.
The Secretary Ministry of Education, Northern Province, the Director Teaching Hospital, Jaffna, the Brigade Commanders, Divisional Commanders, the DIG, and Sri Lankan Navy, the Secretary of Air Force, Additional GA, Divisional Secretaries, Local Service Committee Divisions, Regional Epidemiologists, and all the MOHs and SPHIs. Good morning to everybody. First, I would like to thank, because since March last year, there was a very good teamwork in Northern Province. We got a very good support from all the government agents, regional secretaries, and all the asset commanders, and the police, Navy, Air Force. Actually, with all your support, we were able to confine the outbreak of COVID-19 in Northern Province. When you compare with the other provinces, the numbers, the positive cases are much less in Northern Province. It was a very good team effort with all your support. So I have, on behalf of the Health Department, it is my duty to express our gratitude to the Sri Lanka Army, Police, Navy, Air Force, and all the government agents and divisional secretaries and all the other departments, education, local government. So we expect the same support in future also. So now I will go to quickly present the present situation of COVID-19 in Northern Province as it is today morning. You can see the Sri Lankan situation today morning. We got in Sri Lanka 46,248 positive cases. Northern Province till today morning we got only 263. In Sri Lanka we got total numbers 219 deaths, but till now we got only one death in Lorient State. So this is the situation overall. In March we got 17 cases from the Ariana cluster. Then April to September we didn't get any single case. In October, after the Peliagoda and Minimagoda cluster outbreak, we got 39 cases in October for entire Northern Province. Jaffna we got only 13. November, Jaffna 9 cases, Northern Province 30. December, after this our Mardanamada market cluster, we got 135 cases in Jaffna and Northern Province 153. In January, up to now, in Jaffna we got 11 cases and Northern Province 24 cases. So altogether up to now, we got only 263 cases in Northern Province and Jaffna district only 184. When you compare with the other provinces, we are in a better situation now. This is the breakdown of 5 divisional secretary divisions. You can see because of this Madanamadam outbreak, we got a lot of cases in Telipalai and Uduvil remote areas and Nandipalai because of this Madanamadam cluster. Next, these are the other districts. Next. We got only one death in Borneo district, unfortunately, 26th of December in Borneo hospital. This is the earlier cluster in March. We got next 15 minutes. Because at that time, actually, with the support of all of your support only, we were able to prevent the massive outbreak at that time. Next. Then actually we introduced a hotline in Northern Province. It served a lot for us, it helped a lot. Because we gathered information from the public. The public provided information to us about various information to contain this outbreak. And similarly, people receive the information. If they have any doubt or any questions or clarification, they can contact this number. It was very successful and useful for us. Next. Then actually, how to reduce the congestion of the people, public gatherings. So now, at the moment, we decided to curtail. Actually, this is not the Northern Province region, it's a national level region. The religious places, we allow the people only to conduct their religious activities only with maximum 50 people only. The weddings actually now stopped at the wedding halls. They can conduct their weddings at home with 50 people. At the moment, until further only, we stop the sports activities. Funerals, we inform them with the minimum, with the 25 people, but within 3 hours, they have to complete all the rituals and they have to finish it within 3 hours. And the private tuition classes are still not allowed in the country, and public transport passengers to the seating capacity. Then we register all the people who arrive from the other provinces. Next. The PCR testing capacity, teaching hospital Jaffna is doing 400 PCR tests per day, and medical faculty is doing 240 per day. So we have a capacity of 640 per day. I have to thank both the teaching hospital Jaffna and the medical faculty. They are doing a very good job, very wonderful job, because per day, northern province, we are catering nearly 640 other provinces, except the western province. They are struggling to do the PCR test in time. Now we have almost cleared all the backlog. When you give the sample, or either on the same day evening or in the following day, we are getting the results. We have cleared all the backlog, so we are working the lab. They are working very hard and they are supporting us very much. So why the antigen test? Actually, there is an issue about this antigen test. We have a lot of false positive as well as false negative. So the problem we can't completely rely on the antigen test. Last week we got a lady in Srinagar hospital admitted. When we did the antigen test, it was positive. We repeated the test after 1 hour, it was negative. Then we again the following day we repeated the PCR, it was negative. So it was confusing. So when you do the test, our consultant communication, we will elaborate on this later. When you do say 10%, so if it's 5 positive, that means those 5 positive, it depends on the technique also. When you take the sample, if some blood stain, a small blood stain, you will show it's a positive, it's a false positive. Similarly, if we say 5 negative, it will give a false assurance that they are completely free of virus. They might be positive. So antigen test, because other provinces they are doing because their PCR capacity is very much limited. Even the eastern provinces, other provinces, their capacity they can do maximum go for 300 samples per day only. So they have to go, they are no other way, they have to go for the antigen test. So we are waiting to, if we are unable to cope up with the PCR test, then we will go for the antigen test. Because if we start the antigen test, it will confuse us, the actual picture. So that's why our health team, our CCP also will explain later. Our CCP and regional team audience, we took a decision to weigh, if we can't cope up with the PCR test, then we will go for an antigen test. Next. PCR test actually in October we did 724 tests, in November 9,280, in December we did 30,743 tests. This is only Jaffna. We have sent some samples to Colombo also and Andhra also. That is not included in these numbers. Next. Then community sampling we are doing from the highest people, fishermen, coastal area communities, prisoners, factory workers, construction workers, hostels, universities, markets, and three-wheel and long trip drivers. We are taking regularly the samples from the long trip lorry drivers, bus drivers, fish cooler lorry drivers, and we have established 2 roadblocks in the morning sampling. Actually, our sample remote is doing in the A9 road as well as the Sandipati road also. We do the sampling early morning, 3 a.m. to 5 a.m. or 6 a.m. The long trip drivers will take the PCR sampling. We are doing on a regular basis. Next. Then hospital sampling, we are taking the sampling on a regular basis from general hospitals, 10 samples per day, base hospitals 5 samples per day, divisional hospital 5 samples per week. Because when the people get sick, when they have fever, cough, respiratory symptoms, they go to the nearest hospital. So if the people come from these symptoms, randomly we took these samples. From these samples also we got a lot of positive cases. Then we have a triage system in the hospital OPDs. Next. Then this is the challenges. We are highly worried about the Indian connection because the incidence of COVID-19 is very much high in India, especially in Tamil Nadu, South India. And as the SF commander mentioned, the new virus from UK also already in South India is already there. So we are very much highly worried about these Indian connections. So border crossing fishermen and the smugglers. So the Sri Lanka Navy, they are doing a good job to enhancing the naval patrol and controlling them. And we had the training program for the fisheries department officers. to educate the fisheries communities. And we had the awareness program for the coastal area communities with the help of the divisional secretaries in the coastal areas. And we have vigilant committees also established by the divisional secretaries. And they have already arrested more than 60 people. It was about 1 month back. As the SL commander mentioned, there was a big challenge for us to keep the fishermen or the people who were arrested. Because for the last 1 year, almost 8 months, we are struggling. We have to keep the people under quarantine. The people, as you have pointed out correctly, they have to be kept for 2 weeks under quarantine. Then we have to go for a PCR test. After they are cleared only, they should be produced in the courts. So we have kindly request the Sri Lanka Navy to organize a suitable place to quarantine. This is the issue is going for the last 8 months. Next. Then other challenges, the return is from high-risk areas, other provinces, then the university students, the lorry and bus drivers, fish cooler lorry drivers, then the markets. Markets are the very hot spots in Sri Lanka. As you are aware, Peliyogoda market, Manik market, Dambulla market, in Eastern province, Uttar market, then in Jaffna, Madhanamada market, because they are very interconnected. They used to come from, they have the connections from, they used to get the wholesale vegetables from those markets, and even within Jaffna also, all the markets are interrelated. The sellers, the traders, they go move around. So those are the one, these are the challenges for us. Then the construction sites. Now at the moment there is a high road project is going on. There are 17 construction companies are working in Northern province. So we had a discussion with them and we have prepared guidelines because their staff used to move around and go to on the holidays and come back. So we have prepared a guideline. We had a very good discussion with them, and now because we got nearly 19 positive cases from the construction site from Pavania and Rajah and 2 from Belani also. So we are monitoring them on a regular basis. Next. In the religious places, this is another challenge. This is a very sensitive area also, but we know the divisional secretaries and MOHs, they are struggling a lot to control these. Next. The COVID treatment centers, when I come to Jaffna, we have one in divisional hospital at Mardankarni. We started actually in October, but we temporarily closed from 29th of November, closed. We had a flood and all the toilets were filled. So then, by the time we established the Greenwich, we established a provincial infectious disease hospital with 200 bed capacity. We now with the support of the health ministry, and there we are developing the stage 1. We are doing the stage 2 also. We are expanding that and with another 200 bed capacity. So it will cater 400 bed capacity. So even though 200 bed capacity, today we have only 100 patients there, 98 patients are there. So we can accommodate another 100 patients. Our challenge in the COPA one is continuing COPA is run by the team of Jaffna. Our main challenge is to provide the medical team, because for these centers we have to send the doctors, nurses, all the team, other staff. The problem, they can't come on daily basis. If they go there, they have to stay there for 1 week continuously, and the team will be replaced by the next following team. So we have already shortage of doctors and nurses in our hospital to run our government routine hospital work. So despite of all these difficulties, we are mobilizing the staff from all the doctors and nurses from all the hospitals, and we are sending. At the moment, we are sending the Greenwich provincial IDA from all 5 districts. We are mobilizing doctors and nurses to that center. So if we establish the method everywhere, so many centers, the problem we will be unable to cope up with the medical teams. So at the moment, the Greenwich one, we have 100 beds are free. Only 200 bed capacity, we have only 100 patients are there. If it is get full, we will immediately reopen the Mardankarni. Mardankarni is ready. That is ready. Only because of the toilet pit and flooding situation, we close that temporarily. If we need immediately, we can open the Mardankarni and we can 50 patients there, accommodate 50 patients. So that's a challenge for us actually, medical team to. Yeah, if the Mardankarni also full, then we will be
ready.
Yeah. And Mahakulam also we ready for another one, small one. We have either 30 bed, that also ready. Next. support actually enforcement of the cassette notification, this hand washing, mask, social distancing and temperature monitoring. So register, every institution must maintain a visitors register, then enforcement of the guidelines of all institutions, then avoid the unnecessary functions and hanging. Here we need the support of the security forces, especially police. They are doing a very good job. They are supporting us in the public places. In the public places, they have to make sure that all the people they wear the mask properly and they maintain the social distance and washing facilities. So please kindly support us. Already police and we request the Sri Lanka Army also. I know you are supporting in your roadblocks and checkpoints. You are already supporting. Please continue to support us to enforce these regulations. And the other one, as in the SF commander's presentation, he mentioned the home quarantine. The challenge actually, that when you keep the people under home quarantine, they move around. Even though we tell so many advice and I tell and advise them, but they move around in that area. That's a challenge we face our defense facilities and our MOHs, PHS. So we need the support of the police and the army also to maintain that. We put the sticker in the gate, so they should be aware. And in the case of lockdown, definitely we need your support. We have to block all the areas. So these are the support. The roadblocks actually. Another one, the challenge what we face, all these in November, December, all these positive cases are the contacts. Either they came from the other provinces, high-risk areas, or the contacts of the people who came from the other risk areas. So if you can have from these roadblocks actually in the A9 road and the Sangapati 832 road, if you can at least inform us the people who are coming from the other provinces, within the other provinces, there is no issue. If we can get the details from you, then definitely we can inform the area MOs and they will go and analyze case by case and they will decide whether to quarantine them for 2 weeks or to take a PCR. If you can get those information, it will be very useful for us.
We will try to get this information. Only thing is, we can establish but we cannot check each and every one. There are a lot of vehicles coming in. But yes, of course, randomly check and let to know about all these information.
Thank you.
Who are working in the front line. In this regard, we are operating the cell with the army officials, navy, police and public health inspectors, and we have introduced the hotline also to easy access the frontline officers as well as the general public, so everyone can easily contact with the operation cell. The next thing is we are updating the situation report. Daily we are updating the situation report, and because certification of the secretary, we are sending to the situation report to the Covid Center as well as Ministry of Defence and Disaster Management Center and other respective agencies. In this situation report, actually we have included the all comprehensive details, especially this number of the families and members under the quarantine, as well as the number of positive cases, suspected cases, and number of the patients who are discharged from this hospital. And simultaneously, when we are updating the situation report, we are preparing the this map for the COVID-19 also. In this case, we are updating this. Actually, this map is a live map. We are daily updating this map. And in this case, we are updating the district map as well as the division map.
Commencement and Hachadevu temple festival that our bishop already been sent there. And the other one that tuition centers and these are the hall operators that they also submit this request when they have to open. And other small the key issues we have to discuss. I think our Secretary of Education is here. Quickly respond that what are the arrangement and how to cooperate, what are the cooperation or support expecting from our side and
the chairperson and the government agent and the SF command, the Jaffna and the coordinator for the COVID control program, and our teenagers of the and other from the resources and the director of the hospital, for my colleagues and friends and ladies and gentlemen, morning to all. So at outset, I congratulate the ISO commander for being appointed as the coordinator for this COVID program, very excellency. And as rightly mentioned, the DA and the PDHs, they have already initiated this program under the chairman for the Honorable Governor, and we have already started the program, and as we all mentioned, that we are in better position. So I must thank all the health officers, local government officials, and all the resources for working as a team to make this effort and control this measure in the province and particularly the peninsula. So with that, as I rightly mentioned, we are going to open the schools coming the 11th, coming Monday. We are going to start the schools without the difficulties. And the Excellency of the Honorable Minister has given the order because we should start the education, because you all know that if we are producing the next generation, so we must start the school to adapt the new normal life. That's a practice where we have to educate the children and the teachers and all the education community to cope up this mechanism to start the school. So by January 11th, we are starting the school from grade 2 to O level. So for this BCS exam is going to be taking place in the March 1st. And those are sitting for the O level for this year is going to start on the January 25th. And for the grade 1 admissions, we are expecting them to enroll in the February, during the February month. So this is an arrangement for the starting of the schools in this province and at the national level of the Western province. We have already adopted the guidelines given by the Health Ministry. We have read over the Education Ministry, and we are starting all the phase because already we started the schools in between. Already this arrangement for this health, hand wash, sanitizer, and mask, all these systems are all in place. But we have to be again there will be some need to be repaired and also modifications required. Up to now, government gave us 57 million, out of which 27 million spent for the school facilities provided for this COVID, coping the COVID arrangement. And with that, our challenge is we already have spacing arrangements because we are in better position because our children are in limited numbers. We have nearly 1,003 schools all over this one, 4 schools in Jaffna alone. We have 5 zones. And other than the big schools, there are no issues with the spacing the children in the classroom. So we are limiting the children 25 per class. And but in the big schools, we are making arrangements to have a rolling out mechanism. That Monday, Wednesday, Friday for the first group, and Tuesday, Thursday, Saturday for the next group in the timetable arrangements. There was a question raised because how we are going to manage the syllabus. We are making some co-curricular programs, with the Zoom classes and some working card arrangements. We are trying to finish the syllabus in time. And particularly we are focusing the O-level group, so that's going to sit for the exam. We are making them additional effort, and we are encouraging the teachers and the principals to have some other facilities for the children to make them confident to sit the exam with other revision classes. And with that, already government, we are already take some initiative to start the sports programs also, because they all know that we are seeing this IPL of the players have a problem with the health facilities. So we have to encourage the children to start with this individual program, individual game, which is given by the health guidance clearance. So we are encouraging that also start. And with that, even interestingly, when we had the meeting with the Honorable Governor in charge with all the districts, we already said they have no request to start the school. They have request to start the tuition. So I think that is the demand of the parents and the well-wishers. So I think tuition class is also going to start. That means safe system should be adapted. As I mean in short, we have made all the internal arrangements intact for the starting of school. Our challenge is external, starting from the transport and the surrounding of the school. So even the Honorable Governor and the SFR also mentioned this because we are making some challenges with the vendors sitting around the school. So it must be cleaned up. I think we request the Dr. Commissioner of Municipal Council and other PHAs and other team to clean up the surroundings. We should not allow any vendors to sit in the area and selling all this stuff. So it's an important thing. I think we should address that issue also for the school starting program. Then for the transport, we encourage the students and the parents to come on their own first and gradually using the transport. Again with the health guidelines, with the spacious arrangement, and the health and the driver and the cleaner should be undergo the health guidelines, and they have to provide all the facilities accordingly. Then mask is another challenge as I said because we have help the police. It's an adaptive system, but the problem is after some relaxation mode, people are still relaxed. And we should encourage, and punitive measure is the best mechanism. But so that we have to encourage that. People at least should retain those who are not wearing the mask, or they are wearing the mask not in the proper way. So it is important. Then moving to the quarantine centers, I said, like I said, so the strangers you can easily identify. Now the issue is the family members are coming from the outstation. It's an issue. So the neighborhood facility, particularly in Jaffna, municipal area, that is the challenge, where the children they are not unknown, we say. So children must be educated, and also the society should be given some sort of awareness. What is a dangerous situation will may arise without we addressing these particular issues. Those are coming from outside, in Colombo and other places. Then with the other areas, I like to say, for the challenges, the gathering places. When you are starting the school, nearby shops, then other malls, centers, we should regularize those areas, because children may get into that area to pass to get access to home and the schools in between. Then other areas, now the season is coming up, Taipongal and Kachari festival, and also this New Year is coming up, so we have to strict control and we have to educate the children in society through children. That is our, I write the DMC. As I said, just I got that urge that you have to get those voice recording that can be played in our during prayer time in the morning to get that message passed to the children. Then finally is disposal. Again from the quarantine centers, other places, I think locals are doing a good job, and especially this one, gully emptier. The repeated request not use that in the morning peak hours. When the children are moving, or the tanks and these disposals are dropped before the hotels and other places. It's a nuisance, and it's I think public nuisance, so that can be addressed, and the body will do something. And also we make some request to have a sticker on the back, the owner or the contact of that particular users, so we can address those issues directly to the owner without disturbing the driver and the flag. So those were just the issues. And particularly when you are doing these exams, we need to move care, because we have to distribute between areas and the centers. And always thank the commissioner and all the local authorities, they always extend the support, so that we can control. And one more thing, now we are moving on to COVID, at the same time the dengue is also coming, because after monsoon set, most of the places are flooded, and we will be having problem with the dengue, because suddenly it may outbreak of the boom. So we have to make some control measures, starting from school, because we are opening the schools after many weeks, so we have to clean up procedure. I expect SF commanders assistant to the leader commanders to support that. Clean the school, we have to encourage the parents and OBS students also taking that. And so generally, these are the comments, and I hope as a teamwork, we can cope up with the new situation, and we can get start the full and quality education for our children. Thank you so much.
Hospital, of course, is a tertiary care and similar institution. Our major role is to treat patients, so therefore now when suspected case or the COVID positive case come, we are ready to treat. We have the facilities. In addition, we are running the COVID-19 treatment center at Kopai. Up to now, we have admitted 1,284 patients from various places. It's centrally coordinated, and among them 953 discharged to their home. So that center is successfully, and with the great challenges we are running, and we have the laboratory, as the Provincial Director said, with all the support from the Provincial Director, especially from the security forces, Rajah and on behalf of them to they said command, and because we have get very good support at the COVID-19 treatment center without any complaint. We are running, even though now we have in this center now we are getting all the necessary facilities. So of course now there were 22 newly diagnosed hypertensive patients treated, and about 15 patients were newly diagnosed as diabetic. When they come to COVID-19 center, now we have the mechanism. Among them about 27 these drug-abused withdrawal cases we successfully managed. So with the 2 weeks now, the center has all the facilities. In fact, now all 4 religious praying arrangement is there, and within them there are sporting facilities, So keeping them in 2 weeks is very good, very nice environment, and especially at the plant we are getting food supply from the security forces. They are giving on time, and we are concerned about more than health, we are giving health promotion. When they get treated in the center, they are going with all certificate and all the arrangements, they are going. Therefore, I should thank all the supporters to run that center. So, in addition, our major role I should tell, because now we have some other commitment, in the northern province as a tertiary care center, accidents, suicide, deaths, and most of these other complicated cases we are managing. So, our major role now we have to treat as a tertiary care center. So therefore, I am very happy about the arrangement of this new way of managing or fighting against the COVID-19. For all this coordination, I am sure we can control well. Thank you very much.
Thank you. And as a technical lead for the province, I would like to express some of my opinions regarding the NDJ, because we have been communicating all the province, the community physicians, consultants, we have been communicating in a daily basis, and we have, with the evidence, we have some opinion. Now, NDJ is not a recommended test, because there is a lot of false positives and false negatives. So I am simply saying, if there is going to be 10 COVID patients, it may detect only about 4 or 5. So 5 patients will have COVID, but they will think they are negative, so that they will get a false reassurance. So that is one problem, and then it has to be coupled with a PCR. So there is no double cost. Then other thing is, if there is going to be 10 normal patients, it may detect 3 or 4 as COVID. So these poor people are actually victimized, not having COVID. So they have to be quarantined, then we have to do PCR, then we find it negative again and again. So we say, no, you don't have COVID. So this is false positive and false negative are highly possible in antigen test. Only place where antigen will be useful, in my opinion, is when there is a highly symptomatic patient will have positive, so that what we will do is we will take the patient out of that crowd and isolate him. Not waiting for a PCR results will take about 24 hours. So the patient, the environment is safe because patient is isolated. So that is one thing. That is about the antigen test. And other thing is also about the tuition centers. Our Honorable Secretary Education was mentioning correctly all the measures, and also I would say that we have to go by case. If the tuition centers are allowed, still nationally it is not allowed, and if it is allowed, then we have to, the MOHs, the regional epidemiologists will have a role in ensuring that all these measures are abided in the tuition centers, and it is continued to be abided, and we very humbly request the forces and the police support for us to maintain it. I think that's my opinion. Thank you.
Yeah, the challenge for us, normally Katholic festival, the Indian citizens and Sri Lankan citizens will usually basically there. So that will be another hotspot and challenge for us. So we will discuss with the Ministry of Health, National Ministry of Health, Epidemiology Unit, and we will prepare the guidelines from the hierarchy from the central level, and we will officially inform from the Ministry of Health. And for the wedding halls, actually we have to wait for some time, because still we are getting the cases in the community. So for the wedding halls, to allow the weddings in the wedding hall, we have to wait for some time.
Chiefs and India President. I think first of all, I have to congratulate SEC Commander since he has appointed as a coordinating chief of Jaffna district COVID-19 prevention program. And I take this opportunity to wish you a very happy, healthy and prosperous new year. As a district, as a province, in prevention of COVID, we have succeeded so far. If you take figures in Jaffna district and province, especially northern province, we are far better than other provinces. So today I got some statistics with regard to eastern province. Eastern province, there are more than 1,500 positive cases at this juncture. So here in our northern province, we have just 284 cases. So this is a combined effort, teamwork. So what we have to do, we have to continue this good work with the support of each and everybody. From police, my officials, we will give maximum support to do the business well. And we have minor things to rectify, and we will rectify those things with the time being, and we will continue our good work in this Jaffna district as well as northern province. Thank you.
Let us know if we can enhance anything, any support. Monitoring group in the GS office. So if you have anything, any related, any issues, please do contact the police officer also here, the Army, Navy, Air Force and the disaster management officials, and we are functioning this monitoring cell. If you have anything, you please make that note, and if you want to clarify anything or if you want to report anything,
yes,
let us know.
I'm Dr. Jaffna from Karan. Recently I faced a problem from Karan Suran Festival. When one man come and threatened me, I complained to Kites police station also last December 23rd, but still that man not arrested. Still he is running and hanging all the ways and threatened through the phone daily, but still not action proper straight away. Because of the big temples, we try to control it 50 people and like that. There is a pressure even from higher level also. That should not be happen in future, hopefully. And another thing, we need to get details from the public transport, especially CTV. There's a rule, they take all the details from passengers, but that's also not happening in their transport services. So we faced difficulties recently also 2 days back, one CTV from Colombo, that 3 COVID patients traveled that bus, but still we couldn't find that all the passengers details like that. So kindly instruct to higher officers to CTV, get the details correctly when they are transferring like that.
Very much control in this Jaffna Peninsula with the support of your all the right five forces and police and the stakeholders. You are given your full support in this regard in order to control this pandemic situation since last 2020 January onwards. So that I would like to express my sincere gratitude to all of you, including our tribals and police department. Especially I extend my sincere thanks to our health sector. MOH and PHI are very much and very dedicated as well as satisfied and they are life in this regard. So they are continuous support and continuous actions. These are results for these. Now we are in these circumstances. So that I very much express my sincere thanks for you all, MOH and the PHI and our RDHS and our PD and the health department, the other doctors and nurses and other health workers. And even though they have some shortcomings, they did wonderful job with the support of the army as well as the police. So we have established, immediately we have established this treatment centers and quarantine centers, and they also supported in various ways. And also now the marketplaces, as health sectors advise, we will discuss later. We will wait until such period improve, then we will think about that, open the marketplaces. And also religious places also, we are continuously that guidance, the 50 until such period. Kindly our division secretaries note all those things, and ACLG and inform to your Pradesh Sabhas and local bodies and GS accordingly. And then Kachadivu East, this is international level, we are observed that annually, but this year that our Bishop sent a letter. However, we will discuss other higher level, and we will take a decision at that after that discussion. Then other these wedding hall operators, already we have allowed that 50 member participation, any seminar or meeting or any training. That is a guidelines in force up to now. But we are not not allowed that for the wedding purposes or any other social gathering purposes. So that we will discuss and decide later on another 2 weeks time. This school matter already been our secretary explained. I request our division secretary. The school children are, this is a very vulnerable school, very seriously we have to give the awareness for them. Parents, teachers, principal and other level, each and every GN level, you have to call that school community and explain the situation and how to behave them. This education ministry published that notice how to arrange that, how to follow the health guidelines and what are the things, series of the action they have to take. So that please call each and every village and through the GNO, some sort of our PHA, with the help of the PHA and other police officers, you have to, that awareness program should go to their level. That's must. Better to avoid the distance transport for the children. I think, of course, otherwise the special arrangement they have to follow that with the social distances and other things. Then other cinema also now open with the limited 50 people and social distances and other things. Other restaurant and other things also, they are allowed that with that health guidelines. Our PHA and we are monitoring that activity. And other things, one or two interruptions or disturbances through some people, like our Coimbatore MOH and Karan MOH, they reported. Kindly, if anything, similar cases or any in future, please feel free to report to us. Our hotline operation cell 021 211 7117 021 211 7117. In addition to that, already our SF command also told that hotline. You can, otherwise you have to dial to me or anybody, additional GA or anybody, then we will take a immediate
Anything else